Hi everyone, and thank you for this opportunity to present to GIS experts across USDA. First, I'd like to acknowledge my co-authors. I'm Marlon Eve, Deputy Administrator for Natural Resources and Sustainable Ag Systems at the Agricultural Research Service. And working with me and supporting me on this presentation are Dr. Pete Kleiman, Dr. Darren Harmel, Lindsay Messenger, and Bruce Vandenberg. Thank you so much to my co-authors for helping me with this presentation. The current COVID-19 pandemic has posed many unique challenges for all of us across USDA. In ARS specifically, we have over 6,500 researchers, technicians, and support staff that are located at 137 research labs and work sites across the U.S. Ag research, as you probably can imagine, is a very hands-on activity. In our posture of maximized telework and social distancing, getting our research done can be a real challenge. Throughout the COVID-19 pandemic, ARS leadership has maintained these core principles. The health and safety of all ARS employees is absolutely of highest importance. Decision-making should be data-driven, and our research mission remains unchanged, even though our circumstances may be changing. About a year and a half ago, ARS embarked upon a new effort that we've called Partnerships for Data Innovations. PDI is a grassroots effort led from the field and energized by the need to innovate the way we collect, handle, store, process, and analyze our data sets. Through PDI, we're learning how to better leverage the power of strategic public-private partnerships and how to organize and access standardized data for big data and AI analyses. The Partnership for Data Innovations has these four primary goals. In the end, really, our objective is, our mission is leveraging public-private partnerships to create customized solutions to reduce the time our researchers spend on data management so they can spend more time on their science, or accelerating agricultural science. Several months ago, many of our leaders in the field recognized an opportunity to apply our research tools developed through PDI to help us to better manage our workforce returning to the lab. COVID-19 pandemic presents several urgent challenges. Things like, how do we protect employees when they're working on site? How do we coordinate across numerous agency roles, including safety and health officials, leadership, administration, scientists, technicians, and our facilities management? How do we continue to meet our research mission during a time of pandemic? And how do we ensure the privacy and information security that is needed? So these leaders across our research locations saw these challenges, and they challenged the PDI team to come up with tools that would address these challenges and help us to manage a safe return to workplaces for our scientists. The result is ARS Check IO, a field-developed, location-deployed tool that helps us ensure the health and safety of ARS employees while offering the ability for the facilities managers to target cleanup to specific areas that may have been infected. The PDI team moved quickly to uncover the information and data that was needed to develop this tool and to begin to put things in place to create the ARS Check IO. So far, the team has created 4 basic deliverables. One is an easy-to-use app that works on computers or smartphones or tablets. Second is a dashboard that location leadership can use to track who's been in the facility and who they've been in contact with and where they've moved around the building. Third is a user guide that's available to help users of the app and the tools to to know how to get the information they need. And then fourth is an interactive story map that we've used to help communicate the power and utility of ARS Check. I'd like to demonstrate just a little bit of the power of the story map today. The PDI team has used this story map to help us communicate about the use and value of the ARS Check IO tool. In a minute, you will see a brief video here that just gives an overview tutorial of how the user interacts with the tool on their smartphone or other device. So as you can see from the story map, ARS Check IO has been designed as a tool to allow location leadership to help keep their employees safe, to target the cleanup and sanitizing of facilities, and to maintain a safe work environment for all employees. The ARS Check IO has been designed to follow all guidance from CDC, from the USDA Pandemic Playbook, and from ARS senior leadership. The deployment progress so far in just the last few months has been quite impressive. The Survey 123 app from ESRI has been pushed out to nearly all devices across the agency. 36 of our 90 research locations are currently using or in some part of the process of implementing the use of the tool. And over 1,700 employees are currently signed up within the ESRI toolkit and with access to the ARS Check IO tools. Now I'd like to take this opportunity to show you the ARS Check IO tool in action. In the following few minutes, you will see an example from our Fort Collins location explained by Darren Harmel, Lindsay Messenger, and Bruce Vandenberg.
The COVID-19 pandemic has challenged ARS employees like never before. How do we balance the safety of employees, our families, and our communities, and achieve our mission? In anticipation of the need for a system to aid our safe return to work, the ARS Partnerships for Data Innovations team worked with ARS leadership to create the ARS Check In-Out app, or ARS Check IO for short.
Early in the pandemic, we quickly learned what a positive COVID case on site can do to attack employee morale and bring research to a grinding halt. Without detailed information on facility entry, timing, location, and personnel interaction, we had to close the entire National Laboratory for Genetic Resources Preservation in Fort Collins, Colorado for more than a week, even to employees working on critical plant and animal germplasm curation. This delayed genetic sample processing and caused concern for employees over possible exposure and led to considerable expense for properly sanitizing the entire facility for a safe re-entry. The loss of valuable time and financial resources would have been drastically reduced if we had an effective system in place to document facility entry and guide our response.
Once you have it set up, ARS Check IO is easy to use, taking just minutes each day. Employees simply report when and where they were working and if they had close contact with anyone.
The Fort Collins location has been using ARS Check IO for a few weeks, and we can now conduct contact tracing and quickly develop a plan of action that is both precise and accurate. Instead of shutting down a facility for days, we can target cleanup efforts and report positive case information securely and efficiently, allowing us to maximize operations, accelerate return to work, meet reporting requirements, and alleviate employee stress, all within COVID-19 response guidelines. As we move through the re-entry phases, such reporting and response will become even more valuable.
ARS Check IO isn't just about contact tracing and facility cleanup. It serves as an important wellness reminder for anyone visiting ARS facilities. ARS is a large national agency, and it is often difficult for each of us to remember all the necessary steps to keep our workplace, families, and communities safe.
I am here to demonstrate the steps required to report a possible COVID-19 positive response using the ARS Check IO survey application. Displayed on the screen is a survey that has been filled out throughout the day, logging rooms entered and people encountered. At 12:47, an employee starts expressing symptoms. They check yes and follow the instructions in red, as well as the 4 points below them. Scrolling down, daytime in has already been filled out. They log their exit point and they fill out their daytime out. They press check to submit the survey. Once they have checked yes to the wellness check, the area and location pandemic coordinators are notified, as well as the administrative officer and supervisor. Please note the employee number 6B071 and the mode code 3012 for use in the dashboard. The pandemic coordinator can now go to the ARS Check Plains Area dashboard. Here, they enter the focused area as the end date and 48 hours before as the start date. This is required by ARS when you have a positive test for COVID-19. They then select the area. They select the mode code location, which we noted in the last email. They select the building. And lastly, they select the employee. Now, what you see in the next pane in red is that employee's name, when they checked in, when they checked out, and they responded yes to that. If you click on this, it will filter it down by the rooms they went to on the day they tested positive and the people they encountered. Those are highlighted here in blue in both cases. Additionally, to track the 48 hours beforehand, you can go to the day before and see the rooms that they were in that day, as well as the employees they encountered that day. And then finally, go back 48 hours and you can see the rooms they were in that day and the employees they encountered that day. Next, we are going to identify the employee and the employees that person encountered in the 48 hours prior to answering yes to the wellness check. Presently, this is an Excel sheet lookup, but the PDI team is working to create another dashboard to be able to allow pandemic coordinators to look up this information quickly. Note the employee number and the associated name. The first four are who was encountered, and the last one is the employee.
ARS Check IO now plays a critical role, reminding all Fort Collins staff to assess their health and safety before entering our facilities. If ARS Check IO would have been available when our first COVID case was experienced, we would have been promptly alerted to possible contamination, protecting coworkers, and facilitating rapid and targeted facility cleanup.
During the global COVID-19 pandemic, ARS staff have faced many challenges both at home and at work. ARS Check IO was developed in the field by a grassroots effort to make it easy for ARS employees to provide the necessary information for maintaining a safe workplace under the challenges that COVID-19 presents and return to the important work we do in ARS.
I hope you found this presentation helpful and useful. I've included our email addresses here in case you'd like to reach out to any of us. Thank you so much for your time and attention.